ART works on two different levels. One, it works at a structural level and then works on a neurological level. So what I mean by that is an easy analogy is for on the structural level, ART is like the iron that takes out the wrinkles of your clothes. On the neurological level, ART is breaking a bad habit. Okay.
Welcome to the Village Chiropractic and Wellness Podcast with your host, Dr. Matt Green. Join us as we explore health, wellness, and the power of chiropractic care to help you live your best life. Let's dive into today's episode.
Well, welcome back, listeners. Charlie McDermott here, co-host, producer of the show. And the show's star, of course, is here. Dr. Matt, how you doing?
Yeah, I'm doing great. Thanks, Charlie.
Well, how are things in Oakland over Christmas and
they're cold and rainy.
What's that?
They're cold and rainy.
Cold and rainy.
Cold and
how
rainy.
cold does it get there?
Not too cold. I mean, geez, I'm living in California, so I gotta be careful when I say cold and rainy, right? So
I'm with you. I start talking cold when it dips into the 60s here in Florida. So I hear you. I feel your pain.
Yeah. But it's great. You know, my wife is a teacher. And so, you know, during this break, my wife and kids are both home a lot. And that's great. You know, I'm happier for myself, and I wish it for everybody that that we all can enjoy our company, you know, as during the holiday season.
It's a great time to record some podcast episodes too, and help folks out, right?
That's right. That's right.
Well, I'm going to, I guess, label today's episode a work of art. You think that's appropriate?
I like it. You're good with words.
So today we're going to spotlight active release technique, or yes, art, A.R.T.
Yeah.
So, Doc, I figured for starters, why don't you explain? I mean, obviously, you know what art is, and let's hear it from the expert here. Yeah. What is A.R.T. and how is it different from other chiropractic techniques?
Yeah, I'm excited to talk about it today. So A.R.T. stands for, like you said, active release technique. And in my opinion, it is the gold standard for soft tissue treatment. And to break that down, the reason why I think it's the gold standard is that it's highly specific. So when somebody learns ART for the first time, they're going to take a basic course. And one of the basic courses they'll take is for the upper extremity, which basically means the arm. And it takes a whole weekend to learn protocols just from the top of the neck all the way down to the tips of the fingers. It's a whole weekend spent doing that. And there's 110 protocols. So ART really gets highly specific in terms of learning as many of those muscles, tendons, and ligaments and major nerves in the body. So I'm going to point to then, what does soft tissue mean? Well, soft tissue is not hard tissue, and hard tissue means bone. So again, we're working with the muscles, tendons, ligaments, and major nerves of the body. So how does ART actually work? Like that's the basic definition, right?
And just if you don't mind, just to go back before we even get to there, you mentioned what was it, 110 protocols, right? Explain that if you don't mind. What exactly is a protocol?
Oh, thanks. Right. So if we take the hand, right? So there are muscles called the lumbricals. And there's all these muscles and tendons and ligaments that find here. So we're going to have one protocol for that lumbricals. And then there's all the muscles that lie in the interosseous muscles that are going to lie in between the bones. So we're going to learn all those protocols. And then you're going to have the ligaments that attach to all the different bones in the wrist. So we're going to learn a specific protocol for each one of those. And then there's the median nerve that comes up through that carpal tunnel. So we're going to learn protocols on how to open up that area for that median nerve to come through. And you're going to have all the muscles that surround the thumb, and all the muscles that surround the thumb that then follow all the way down the forearm. So for every single one of those tissues, there's going to be a way to treat it. Does that have that be more clear?
So protocols is another way of knowing specifically what, muscle or tendon or whatever it is being impacted and how to treat it. Is that
exactly?
Do I have that? Okay.
Right.
Okay.
Yeah. Thanks for clearing that up. Yeah.
Hey, I'm I want to know what to say next time I see my neighborhood doc. So this is good because I'm going to have him check out something in my calf as we're talking here. So, but go ahead.
Right. Yeah, that's right. So ART also has a very specific way for us to diagnose and to figure out which one of those tissues is problematic and which one of those are normal. So that's a very general scope. To talk more about how does it work, right? So ART works on two different levels. One, it works at a structural level and then works on a neurological level. So what I mean by that is an easy analogy is for on the structural level, ART is like the iron that takes out the wrinkles of your clothes. On the neurological level, ART is breaking a bad habit. Okay. So let's take each one of those, right? So the working on a very kind of structural level, what's happening right underneath my fingers? And first of all, we have to talk about what's the actual problem, right? So when I watched my kids when they were 3 or 4 years old running through the park, it was amazing to watch, to see that they had basically perfect form and function. I mean, their body works perfectly.
Yeah.
What happens through life is that we incur stresses, and those stresses either happen all at once, a trip and fall, sports injury, auto accident or such, and they occur normal stresses, repetitive stresses, sitting for 8 to 10 hours a day, doing repetitive motions or actions, working on the couch, sitting in weird positions and such. Those type of stresses occur to the brain, and if they go over a certain threshold or become a certain threat, the brain's going to respond by two things primarily: contracting muscles, spasming muscles, and sending inflammation. And when we send inflammation, then scar tissue gets set. It's a process called fibrosis. They always happen together. So now we have tight muscles and we have scar tissue that's been laid down in that area to protect that area from it getting worse. Now, sometimes it's small enough that all we need to do is stretch and exercise and move normally, and that all gets worked out. But sometimes that stress is too much for our bodies to heal it by itself, and that pattern stays. So what ART does is it takes, let's say, the muscles in the hand, and let's say this muscle gets overly contracted. So what we're going to do is we're going to encourage the patient to contract that muscle, relax it all the way. Then I'm going to take my hand and go in the very specific direction of those fibers, and then have that patient move those joints in such a way so that I can stretch that tissue in the exact way that it stretches.
Wow.
And when we do that and we apply that force on that very specific fibers of those muscles, then the scar tissue that's in there gets easily broken up, or more easily broken up, and then gets reabsorbed into the body. And when we take that muscle all the way to the end and hold it, we in the ART community, we always joke that we hold it for 2.3 seconds, but you hold it for a certain pause, and that helps that muscle soften. So we're helping the muscle soften, and we're helping to break up that scar tissue so that it can start to function the way that it normally functions. Right? Right. So we're working on that structural level, taking that iron and taking the wrinkles out of that tissue.
Is that where you feel like knots in your muscles in certain parts of your body and
Exactly.
okay,
Exactly.
yeah,
Right. And they have different types of feeling depending on how recent that tissue damage has been.
mm,
It could be either that kind of like soft, lumpy part, or if it's been there for a really long time, it could be hard and leathery.
yeah,
So that's another way for us to diagnose, hey, how long has this tissue been there? How long is this probably going to take to heal and get better?
mm, wow, interesting. Okay,
So that's
oh,
one, right? So that's
yeah,
working on that structural level, right? Where the iron taking out the wrinkles
yeah,
in that tissue. Number two, we're working on a neurological level. So there's a reason we've been on this earth for thousands and thousands of years, right? Like our brains, our body's amazing at keeping us protected. And if there's an injury that happens to the body and that brain goes into that protective mode, it's going to hold those muscles until it feels safe, until it feels safe for it to let go. And again, if these injuries are small enough, maybe all it takes is to get out there and exercise and to stretch for that area to start to move again. Brain gets better signals, says, okay, that area is starting to work better. I'm going to start to let it go. And the body naturally heals itself. But sometimes there are accidents or there are injuries that have happened that are too severe or that have been happening repetitively for too long for the brain to feel safe to let go. So again, what I was talking about, that ART, when we take that tissue all the way, specifically in this specific motion that it is designed to move, and we hold it there, there's little sensors on the ends of those ligaments called Golgi tendon apparatus that's firing up information to the brain. And that's the signals that we want to give to help to override its protective mode. And that's what we want to do. We want to override that protective mode so that the brain gets a sense that it's safe for it to let go, for then the signals that it starts to give it for it to start to act more normally, right? So it got into a habit. It got into a habit that some say could be beneficial for us to help us protect so that tissue doesn't get damaged more, but it's in a habit. It's in a habit of holding it. And we want to help to break that pattern so that it can remember what it's like to be good. And hopefully that's the end of all the stories.
yeah,
that we
yeah.
feel good and that we function the way that we want to, and we get out there and we can get back to playing pickleball or doing the things that we want to do.
Right, right. So, what kind of conditions do you see in injuries and so forth?
Right. So if you can get a sense, there's a protocol for almost every muscle, tendon, ligament, and then major nerve in the body. So you can imagine there's almost nothing that ART can really fix a lot of things. It can really help things. And if it can't fix it or help, it can certainly be a positive influence, right? Because it can have such a broad spectrum. But it's a little too general. So I think a good way to answer that question is that when people send in their paperwork first before I see them for the first time,
Mm-hmm.
some of the issues that I see that they're coming in with that I feel confident right away, I was like, I know I can help this person with ART. First one is sciatica. So sciatica really means sciatica syndrome. It's really any pain that's traveling down the leg, whether down the front or down the back, usually to the knee or sometimes beyond the knee and into the toes. There's these specific protocols for sciatica that's fairly general, not general, a fairly common symptom that people have that come in with. So I would say sciatica can certainly help with that. Protocols for frozen shoulder or a lot of shoulder problems. There's so many ligaments specifically in through here that don't get paid attention to by a majority of practitioners, in my opinion. Because ART is so specific, we're learning all of those ligaments in there. And to go through the protocol to figure out which one is working, which one is not. I'm excited. Well, I don't know if I should say I'm excited when people come in with shoulder pain, but I'm excited because I can help them. That makes sense.
But that must be quite a process, especially I'm thinking the shoulder. There, like you said, there's so many different components there holding that joint together, and they're probably, some of them are pretty deep inside, close to the joint.
Of course. And like I said, sometimes it's not a very deep, well-rooted problem that's fairly easy just to give, a few treatments, a few inputs to that area for it to click back. And other times, it's a shoulder injury it was a football injury 30 years ago with no body work. And, the person works 60 hours a week. That's that. Now, hopefully what I do is I communicate to them what to expect. And I think somebody who comes in like that, they're they would be crossing their eyebrows if I was to say, hey, I can fix this in 2 and 3 visits. So I think people have a sense of how long that's going to take. But no, you're right. I mean, sometimes it's quick, sometimes it's long, sometimes it's somewhere in the middle. Hopefully I do a good job of communicating what to expect. Tennis elbow. I would say right now, pickleball injuries are fairly common and mostly around the elbow, mostly around the shoulder and around the knees. So we got A.R.T protocols for, pretty soon go to A.R.T class and they'll be like, hey, now we're going to go over our pickleball protocols.
Interesting.
Fairly common injuries from there. TMJ, so problems with the jaw. I have a dentist that's in my community that refers people over for people with TMJ problems. I got to say the basics, right? Like stiff neck, stiff low back. Those are fairly common. And then the last one is the migraines. So I would say to somebody, there's probably about a 50% chance that we're going to have an effect with the migraines. Because sometimes it's rooted in the way that the head is situated right on top of the spine. And that occiput and C1 are stuck together. Specific A.R.T protocols for all the muscles that are in through there to allow that head and that top of that spine to glide more freely there. We can keep going with the ankle sprains and, meniscus problems. But I would say, like, if I had to come up with the main ones there, that's a good list.
All right. Well, I got one for you in a second here, but before I do that, I just want to remind your audience, we've created we'll call it a text line. So for those of you who have specific questions or just general questions, whether it's about this topic, ART, or something you'd like the doc to talk about, text us 510-281-1708. That's 510-281-1708. So, Doc, I got one for you. I went out running, jogging about a week ago, and I got about a half mile, quarter mile. And now I know this isn't fair because I'm not in the office and all that. But I just felt this like golf ball, maybe baseball size, like pain. It wasn't a dagger or anything, but I'm thinking I did some damage to the soft tissue. So is that something that this? Again, the disclaimer here: you haven't seen me, you haven't done any diagnosis, but is that something that you could help my recovery with?
Of course. And so we want to look at. What I would do is I would have you on the table and I'd put my hands right where you're feeling it, and then I would have you move your knee and move your hip and move that whole area. Mostly I'm going to ask you, in what direction does it hurt? I'm going to have you move it in that direction. And by putting my hands, I'm feeling for which muscles are grabbing and pulling where I'm expecting them to be relaxed. I'm also looking for tissues that's pulling my thumb forward when I'm expecting it to not. I'm feeling for what's abnormal. Then we do a couple passes, maybe on that specific tissue that I'm suspicious of. And then I have you go back and do that motion. And a lot of times people are like, wow, that doesn't hurt anymore. And so that's the basic process that we go through.
Wow.
You're gonna have to come
Why
out to
aren't
California.
what's that? Yeah, I
You're gonna
know.
have to come out to California.
I'm looking at flights.
Yeah. Right.
Man, this is interesting stuff. I mean, I've been around, I don't know,
You
health
have.
and wellness, for decades.
Yeah.
Why? How old is art, and why
Why do
isn't this
more people know about
mainstream?
it?
Yeah, yeah.
Yeah, well, it's been around since 1984.
Hmm.
Dr. Michael Leahy, he was in the Air Force, and he graduated from where you graduate from when you're in the Air Force. Can't remember that
Air
school.
Force Academy.
Um, um, he went to that school. Can't remember. Anyway, so he's an
Yeah.
engineer. Either way,
Uh,
and when he came out, then that was unfulfilling for him. So then he became a chiropractor. And then while he was a chiropractor, he designed A.R.T. And I have such respect for him and the whole organization. They're always evolving. They're always learning, and their classes are always evolving and changing and learning. It's very important for him to keep
mm,
the high reputation of
yeah.
A.R.T. But when I go to A.R.T. courses, it's primarily chiropractors. I would say it's like 60% chiropractors. I would say it's about 30% physical therapists.
Mm.
I would say it's 10% massage therapists, acupuncturists. But yeah, that's the majority of the practitioners that do it.
Yeah. So we talked about various kind of, we'll call them candidates for ART, whether
Yeah.
it's the pickleball guy or gal with pain in the elbow, or the weekend warrior who's got shoulder issues from the football injury decades ago and things like that. What advice would you give someone who, I think for a lot of people, it's a question of, is this just one of these things that I'll sleep off and I'll be better tomorrow in a few days, or is this going to turn into something chronic? Am I better off getting it treated now, or at least looked at, versus, gutting it out and popping the Advil?
It's a good question. It just has to do with a person's priority.
Mm-hmm.
You're going to have somebody who's, she just came in and won like a fairly high level pickleball tournament. She's coming in weekly, bi-weekly. Sometimes the pain is, in her forearm and the knees are a little bit more intense. Sometimes it's really not much at all, but she wants to work at her best. So she is just going to come in on a regular basis and have me check and make sure that she's operating at a very high level. And other folks, it's not as such a high priority, and their lives are busy. They're working an immense amount of hours, and then they have a family to go home to, and they have other extracurricular activities, and maybe they have a high pain tolerance. So, they'll wait until it gets bad enough where then the spouse kind of pushes them out the door and says, "Hey, you better go see somebody about it."
Yeah.
So, and then there's everybody in between. But I think it has to do with, where's the natural priority? I had really no judgment about that. It's just like, naturally, where's the priority of health?
Yeah, makes sense.
Yeah.
All right. Well, this has been really good. Any final takeaways for
Totally.
us?
I love A.R.T. It's such a great fit for me. I was a massage therapist before becoming a chiropractor. And then when I got into chiropractic school, I got into the cadaver lab, and I was fascinated because I wanted to know what I'd been feeling all that time. So as soon as I graduated chiropractic school, I went right back and I started teaching in the cadaver lab. And so I taught in that cadaver lab for 5 years. So I really got to know, there's no better way to learn than to teach. And so I got to know all of those muscles, tendons, ligaments, and major nerves in the body in a very visceral way. And so when I found A.R.T, it seemed like, what a natural fit. You got to have a good sense of touch, and you got to have a really good knowledge of the anatomy. And so when I found it, I was so happy. So it was such a good fit, and I'm excited always to share it with other folks. I think the one thing about A.R.T is that not a lot of people come in with that, but some people do. They have a little bit of, they're a little nervous that it's going to be a little too intense, or that it's going to hurt, or that it's going to cause them some type of pain during or after. And I just wanted to assure people that there's nothing that I would ever do to cause anybody any type of reason to have to majorly protect themselves while they're on the table. Yeah. Yes, sometimes we're breathing through something, right, in order to break through to the other side. Sometimes that's occurring, but I'm certainly bringing people into that more intense state and then gently bringing them out and checking in with them to making sure that the intensity is okay. Because some people I can't go hard enough, and other people I just start to do the process and they're like, "Ooh, that's a little too much." So there's always a check-in with the intensity with that. But I think those were the other things. I mean, ART is super awesome, and I'm so excited to be to have that. And it's not a chiropractic technique; it's separate. Separate. Yeah, it's separate. But it's a perfect partner, right? It's a perfect.
Yeah, sounds like it. Yeah, love it. Well, for our listeners, again, Dr. Matt is in the Oakland, California area. And I know there's only a few folks like myself who are going to jump on a plane today and check, get my cab checked out. Just kidding. But for our listeners and viewers who are in your area, you will let them know what's the best way. I know you have a number of ways of them either getting in touch or booking a consultation.
Sure. A couple different ways. One, we're located in Montclair Village. Which is like a neighborhood in Oakland, a great little village. Love being there. Hey, walk in the front door, say hi. So that's one. Number two is to call the number that's down below, the 510-281-1708, to make an appointment. Also can go to the website, villagechiropracticoakland.com, and that's a fairly easy process. You click on book an appointment, book a new appointment, and it'll walk you through all the steps to come on into the office. Anything else, Charlie? What about booking a consultation?
Yeah, I think the best for everyone is the 510-281-1708 because hey, for some folks it might be 2 a.m. Couldn't sleep. Maybe they're like ready for ART now because it's keeping them up at night. You can go ahead and text that number and just say, Dr. Matt, love to schedule a consultation, or you have questions, use that number. And you won't get AI. You'll get a real live human, actually a real live Dr. Matt, and we'll hook you up. That's right.
And I think if there's anything left to say, Charlie, is that when people come in to see me, the ART and the chiropractic care are just seamlessly woven into each other. Sometimes people come in, it's very rare, but every once in a while, someone will come in just for ART. But for the most part, ART and chiropractic are both great tools, and I use them together and do an exam, do that consultation, and then come back and let people know, hey, here's how we're going to use these two really great tools to get you better.
Yeah. You're a great teacher. It's been awesome.
Yeah, thanks, Charlie. Appreciate it.
All right. Well, we will see you in the next episode. Enjoy the rest of your holiday there.
Great. Thanks. You too, Charlie.
Thanks for tuning in to the Village Chiropractic and Wellness Podcast with Dr. Matt Green. For more information or to schedule an appointment, visit our website at villagechiropracticoakland.com or call us at 510-281-1708. Stay well, and we'll see you next time.